Welcome to Airway Breathing Conversation, a podcast presented by the anesthesiology residents at the University of Saskatchewan, created to provide individuals of all levels of medical knowledge with anesthesiology-related healthcare information. Join us this week, where Dr. Roman Gusztak, a pediatric anesthesiologist at the Jim Pattison Children's Hospital in Saskatoon, Saskatchewan, and Dr. Sebastien Turcotte, a PGY2 anesthesia resident at the University of Saskatchewan, discuss the anesthetic care of patients with neurodivergent conditions in the perioperative setting from a physician's point of view. Now, whether you are an anesthesiologist, resident, medical student, or member of the general public, come take a break with our host, Anesthesia PGY2 Sebastien Turcotte, and a multitude of brilliant and insightful guests as we demystify the incredible specialty that is anesthesiology, one episode at a time.
Okay, so hello everybody, and welcome to another episode of Airway Breathing Conversation. Today, super excited to be joined by one of our staff, pediatric anesthesiologists, again, Dr. Gusztak, who's returning for us. And this will be part 3 of our autism series in anesthesia. And so today we're going to sort of explore the autism pathway that we have here in Saskatoon, how it was developed a little bit, and then what parents can expect when they bring their child with autism in for surgery, and then maybe some tips and tricks for practitioners at the end as well. So thanks again, Dr. Gusztak, for joining us.
Yeah, no, very welcome. Happy to be here.
Awesome. So why don't we just finished today in the OR together, and we were sort of talking about this topic a little bit and how this autism pathway was sort of brought up here in Saskatoon. But could you sort of touch on that a little bit? Why you sort of took this project on and sort of,
Yeah, some of the background there. So it was just kind of dropped in my lap. I was actually presenting at the Canadian Anesthesia Society conference. I was giving a presentation. John Gamble, one of the pediatric anesthesiologists here, said, "Roman, you just came back from this fellowship. You know all this stuff. Let's present new fellow information at CAS." So I was like, okay. So anyways, did a presentation, and someone else in the same boat was presenting on this autism pathway somewhere out east, somewhere from Ontario, Quebec or something like that. And I was like, wow, that's really good. And there happened to be another pediatric anesthesiologist, Dr. Sharon Wiens, in the crowd listening as well. And she was also like, this is good. Essentially, this new staff was just talking about this autism pathway, which they established in their hospital, and just how it was improving the care of autistic patients, how healthcare staff felt more at ease, parents felt more at ease, patients were having better outcomes, less kind of stress and outbursts and stuff like that. And we're like, wow, okay. That kind of a big takeaway from that whole thing was if you put in the time, you put in the time and effort, energy ahead of time to figure out, okay, what tries to minimize the triggers being acted upon or anything like that. If you put in that time ahead of time, it decreases the risk that you're going to need security called at the end of the day if there's a real bad outburst or something like that. And sometimes these kids don't need security, but it's just really hard for everyone involved, right? Their parents, the medical staff, and everything. And so if you can figure out, okay, what are the modifiable risks that we can avoid to kind of keep these patients as calm as possible, to try and keep them in as much of a normal, and that's probably even a bad word to use because you're completely out of your routine when you're coming to the hospital. Yeah. But how can you minimize those disturbances as much as possible? And if you put that effort in at the beginning, then at the end, usually they do better. And so with that, Dr. Wiens was actually retiring, and she actually gave a $5,000, I think it was $5,000, but some money for this BALANCE program, which was a grant. And so the BALANCE program's out of Halifax, and it's a perioperative program that you can purchase where I think you can train up to 250 people per year. So you get these BALANCE champions, you take these courses, and it's about, I forget what it is, I think it's like 3-4 hours or something like that. And they essentially just give you all of this background information on caring for autistic patients and just educating you that they see the world differently. And also that each autistic patient is completely unique, completely different, right? And so there's one phrase, Derek Chang, he was a resident who him and I were starting on this project together to get it going 3-4 years ago or so. And he's now an anesthesiologist in Regina. Remember, he just told me the phrase that he had read somewhere else. When you've treated one patient with autism, you've treated one patient.
Yeah, exactly.
And so everyone is completely unique. And so you can't pigeonhole, or you can't be like, oh, well, they're going to act like this, they're going to act like that. Well, they might act like that to some extent. But as your other interviewees have told you, like the caregiver is the best for that information, right? So anyway, so we ended up getting that balance program, training a bunch of perioperative, or training the PACU staff, a few of the anesthesiologists, the surgeons and whatnot. And then, so we're doing that. The balance program is great for an educational tool to really open up your eyes to be like, man, these patients deserve extra time, extra attention, extra focus, just because of how just challenging it could be just when they come to the hospital, because they have all these other stressors that they're stressors to kind of neurotypical people, but they just get so much more exacerbated with autistic patients. How this really, and I think why it was kind of a nerve ending to Dr. Wiens and I at the time is we had a patient. It was a pediatric patient. I forget how old he was, somewhere between the ages of 10, 11, 12, something like that. A little bit on the bigger side, obese, had ALL, also had pretty like moderate to severe autism, and was coming in for lumbar punctures, bone marrows, CT scans, all these other things, probably once a month or something like that, right? And you could just see him progressively getting more and more just wild, unfortunately. It's like, it was just very uncontrollable. He was fine when he was on the ward, but as soon as he started coming down to the operating room, when he saw the OR, this was when we were still at the Royal University Hospital, he would just freak out. So we started giving him pre-medication. We ended up getting him a central line, but he would rip out his central line. So he got a central line tunneled in behind his shoulder blade so that you could give medication there without him noticing. And so anyways, it got so bad that he ended up headbutting one of the anesthesia assistants. I don't think he broke her nose or anything, but after that kind of critical incident, it was, okay, we need to set up a individualized care pathway for this patient so that event doesn't happen again. And so what this balance program was suggesting to do, or any of these individualized care programs, is you should be doing that for every autistic patient, not just the ones that are really, really acting out. But everyone, because there's a benefit. There probably is a benefit for every autistic patient when you're just trying to figure, okay, what are the stressors that we can modify, and trying avoiding those as much as possible. And so it's interesting. Winnipeg, Manitoba, they actually, so Winnipeg, Manitoba, they've actually set up their own autistic pathway, or autism pathway, this individualized care pathway. And it got initiated out of a similar circumstance as similar here in Saskatoon, where it was a bigger autistic patient. I think they were like 13, 14, coming in for radiation treatment. So they're getting these treatments every day for whatever it was, 2 or 3 weeks. And then they had an adverse event as well too, where there wasn't, the patient remembers and recognizes, I don't like being here. And then out of that, that's how they started their individualized care pathway.
Yeah, and that's probably one of the major challenges is a lot of these patients, or some patients, they have to come often to the hospital. And once they're faced with one trigger, often that trigger, is almost cyclical every time that they come into the hospital. And so it can be really hard to counteract that. So it sounds like the goal of the balance program, this autism pathway too, is to get ahead of that a little bit, so that even with patients' first interactions with the hospital, there's decreasing that stress, and which beneficial for both patients as well as their families and caregivers and the providers who are trying, just trying to do their best to look after the patient as well. So, in terms of the setup of the pathway, what does that sort of look like for families when their child is coming in for surgery?
Yeah, no, good question. So I'll even say too, just a little bit. So about the pathway, we kind of it's an individual pathway where essentially we've made it, changed the questionnaire, because Balance program will give you their own questionnaire, and then essentially made it like specific to here. The Balance questionnaire was really good for asking about, okay, what does it look like when your child's happy, kind of the green zone, yellow zone, oh, things are getting worse, red zone, really bad, and how do they interact or what do they say? What are some of the kind of physical, are there any physical stressors or stuff like that? Are there any sensory triggers or things that you can avoid and things like that, right? And so we included all that, but then also included in this questionnaire a bit more medical information. From an anesthesia standpoint, I think a big crossroads or a big decision point is, to the parent, do you think your patient or do you think your child needs pre-med?
Right.
And so medication ahead of time. Sometimes some kids need a medication to actually get into the hospital. Sometimes they need a medication to get into the operating room. And so each child's a little bit different. And so that was one thing we kind of added to this individual or into the kind of Saskatchewan specific questionnaire there. And so the way that we've been able to set up, we've actually had pretty good cooperation with the surgeons here in Saskatoon. And so if the surgeons if the surgeons know that the patient has a diagnosis of autism, and if they actually write it on the booking slip, you can write past medical history, they include relevant information. And so if they include on their autism, then we have it so that the scheduler booking the case will actually automatically send that information to the anesthesia department. And then the anesthesia secretary contacts the parents to say, hey, you're booked for this procedure on such and such a day. Would you be interested in, or do you think it'd be beneficial if you filled out this autism questionnaire for your child? And so it's a 4-page questionnaire. We tried to do as many tick boxes as possible to make it easy, but there is some fill in the blanks as well too. There's some things it's just best if you have open kind of fill in the blank areas. And so anyways, the parent or caregiver fills out that information. And again too, this is a copy of it there. It goes over a bunch of things. So do you have any concerns about your child's upcoming anesthetic, kind of regular medical things, allergies, current meds, medical conditions? And then, it goes over things like, what are your child's stress triggers? How does your child cope with transitioning to new environments? Has your child ever been to the operating room before? Did they need a pre-med? Did it work well? Did it not work well? And then approaches to reduce emotional triggers, describe communication style, approaches to helping with communication, and again, a bunch of different tick boxes and things like that. And sensory approach. And then at the end, we have a collaboration with a really good child life therapist, Carly. And so if she's not around, then she can get another child life therapist from JPCH to help as well too. And so the last page there is saying, hey, would you like child life to be involved? If so, they would actually do a one-on-one session with you kind of pre-surgery if you think that'd be helpful. Sometimes it's not. Sometimes for these patients, it's better, hey, less time in the hospital, the better.
Right, of course.
Or if it would be helpful, then she's happy to actually meet with you guys ahead of time. And so there's a little checkmark box. Or she could meet you right in the registration area. So essentially right when you get into the hospital, she can meet there. She has a bunch of kind of toys for distracting games and just ways, or these like sensory enjoyable kind of balls or little clicky things and things like that, whatever a kid enjoys, just to kind of distract him, get him into the recovery room, and then kind of do some of the assessment there. So, okay. So we're trying to, and again too, so the key is to, if the surgeon knows your patient or your child has autism, he'll write it on there, and then it's an automatic process, maybe, and and then once that form gets done by the parents or completed, it gets emailed back to the anesthesia secretary. She sends it to me, and then I give it to the recovery room staff or the kind of pre-op recovery room test staff. They're the same staff, and let the anesthesiologist of the day know that the kid was coming that day and say, hey, can you review all this stuff? Some children, if they're usually taking kind of pre-meds and stuff like that prior to coming to the hospital, sometimes the anesthesiologist will call the parents the day before, just be like, hey, let's just agree to a plan. What do you think would be beneficial, right? And just giving, or just kind of reading everything, giving feedback to the parent to say, okay, I read this. This sounds good. What do you think about this, that, and things like that, right? And so it's, because again, and the nice thing is too, this will be in the medical record, this whole completed questionnaire, so that the next time they come back, the parent wouldn't have to fill out everything.
Right.
And it kind of is a data point or a stamp to be like, okay, this is what we did this time. And sometimes it works really, usually it's much better than what was done without the questionnaire. But then there can be a little bit of fine tuning or tweaking and stuff like that, especially when it comes to the pre-med. Sometimes it's not enough pre-med, sometimes it's too much and they're more sleepy in recovery. And so again, just how when you've treated one patient with autism, you've treated one patient, everyone's unique. They're also very unique how they metabolize drugs and things like that as well too.
Oh.
So you be like, okay, based on weight-based dosing, this should do. And sometimes it does. And sometimes it's like, okay, they needed more. Sometimes they needed less. And then that's where it's beneficial as the anesthesiologist, just to write that on the anesthetic record, just so they know type of thing. But also too, it's very beneficial hearing that feedback from the parents to be like, oh, you know what? The last time my son or daughter had a dental anesthetic, they just, if it was whatever it was, if they took too long to sleep or they had a really hard time going to sleep, then you can kind of titrate or just adjust the anesthetic to hopefully minimize that the next time.
Right. So. Yeah. That sounds really great. And I think one of the key points that keeps coming up there is how family-centered this is. And I think that's something that some of our previous guests along with this series have sort of mentioned, is just including parents, patients in the decision-making process in terms of keeping them involved and comfortable with the plan moving forward. You've touched on pre-med a few times. Do you mind just sort of mentioning how you counsel parents on what the pre-med process kind of looks like for their child when they come in? Because I think that can sort of seem like a big black box for some people sometimes.
So pre-medication, giving a dose, usually not a super big dose, but sometimes a big dose, usually kind of a small, moderate dose of sedation ahead of time to get the patient into the operating room with less anxiety, but also too makes it a little safer, I think, for the healthcare staff as well too, when trying to get the patient off to sleep.
For sure.
And so, and usually if a child goes to sleep relatively calm, usually they'll wake up more calm. So if they're just really angry, really kicking, screaming, going to sleep, there's a good chance they're going to wake up screaming, yelling, kicking, screaming. And then you're going to need some more medication at the end after they wake up, just to kind of chill them out again. So so a pre-medication, common pre-medications are benzodiazepines like midazolam, Ativan. Sometimes we'll use a little ketamine. Sometimes there's a drug dexmedetomidine. Okay. And so the vast majority of times, these are all given through the oral route. And so if patients are cooperative, then we'll give them to them orally. Some of them don't taste that good. So it's each anesthesiologist has their own comfort or preference as to what medications they like giving. And but then too, you also have to combine that with how cooperative is your patient. And sometimes we'll try sneaking in some pre-meds and apple juice or something like that. And there's supposedly midazolam popsicles. We don't have any of those here.
Oh, interesting.
So because midazolam just doesn't taste very good. And so things like that. And so this is where it becomes a discussion with the parents to be like, hey, I'm not a used car salesman. I'm not going to push any of this stuff on you. And so the parents are oftentimes going to say, hey, you know what do you think if we give your child a pre-medication? Are you interested in that? Like, yeah, most of the times, like, yeah, that'd be good. And two, the anesthesiologist, the recovery room nurses, they're also very good to kind of identify, okay, which kids are just more nervous, more anxious, more just like active and just harder to corral or keep in their room, right? Or they're not going to be, or potentially not as cooperative when you're getting them off to sleep, right? Yeah. And so sometimes even the recovery room nurses will be like, you know what? Maybe this kid could use a pre-med. And so then the anesthesiologist will come and we'll just have a chit chat, be like, hey, you know what? This might make the experience of putting the mask on the face a little bit easier for your child because they won't remember, or they'll remember less, and they're just a little more cooperative is the thing too.
For sure.
And so the thing is with the pre-med, there's really some of the pre-meds, again, this doesn't happen very often. Sometimes they can get even more agitated. That's very, very rare. And so it doesn't happen that often. Again, certain with more medications more than others. But if anything, usually if anything, I think commonly will maybe intentionally underdose, because if you overdose, you give too much, then they can bad things can happen, like stopping breathing and stuff like that. So you'd rather give a little bit of a smaller dose, take a little bit longer time for it to kick in, and then bring them into the operating room. So sometimes if you give, but one of the downsides of the pre-med, again, depending on what you do, sometimes it keeps them a little more sleepy inside the recovery room, particularly if the child is just really, really active and you really need to bring them down from like whatever, some red zone in the RPM. And then those kids, they need a bit more time sometimes in the recovery room because that medication does take time to wear off.
For sure.
So.
I think it all comes down to safety as well. Hey, trying to get their child through their surgery, through their procedure safely, comfortably, and so that we all go home at the end of the day and try to make it as successful as possible. So yeah, for sure.
Well, because partly too, and just coming back to, you have two main ways of getting or anesthetizing a child. It's either through a face mask or an IV.
Right.
Most kids hate an IV, and so the mask is less scary, but still can be scary because it's on your face. And so the hope is just to give a little bit of medication just to kind of take the edge off a little bit, and then hopefully get that mask on, and then sometimes too, depending on, we'll bring the parents in the room and just to kind of help with that process as well too.
Sure.
Again, that's kind of anesthesiologist or situation or case by case dependent.
Yeah, everybody's got their own sort of, not recipe, I guess, but everybody has every patient seems to have their own strategies of getting through their surgery. And I know, so, parents, it's always good to check in with them because they usually know what works and what doesn't. I know, in some of my limited interactions with parents, they've mentioned, the anesthesiologist gave this medication last time and it worked really well, or it didn't work quite so well. So just checking in with them and asking what they think might work best is really helpful. Yeah. Do you have any tips and tricks for practitioners when they know that they have a case coming up with an autistic patient? I know we've touched on a lot of things already, but just from your experience, your anecdotal evidence, sort of what you might think works a little bit.
Good question. You know what? I think, it's kind of what's been brought up in your other kind of podcasts and everything, like the parent or caregiver knows the most, right? And it's like, they are your biggest ally and they're the ones who are going to be caring for their child after as well too, right? And so it's kind of, so I think, it's so key getting information from them. I think so part of the thing, really a questionnaire or getting information ahead of time is so much better because you can review it and then you can make a plan ahead of time. Otherwise, patients with autism, if you're trying to collect all this information the day of surgery, it's an extra stress. The parent's trying to talk to you, plus manage their child while they're in this abnormal environment. And so I think probably a key is to do the questionnaire, but do it ahead of time. Winnipeg, they have a nurse who would actually calls each parent, writes everything out. That's a little more expensive. We just email it out so you don't need to pay someone collecting data. But honestly, getting that information a day before or 2 days before, you can come up and make a plan. Because if I'm really honest, when I know I have a older, teenage autistic patient who adult size, man, they kind of scare me sometimes because it's if you do, or it seems like sometimes it's man, if you do one wrong thing and if they get angry, it's it can be a little scary. And so knowing the information ahead of time, being able to review that, being okay, what are the stressors that I need to avoid, or what are the things that they enjoy doing that I can try and do as much as possible, right? And so, and then, I think probably tips and tricks when it comes to pre-meds is probably kind of knowing, and it just comes with clinical experience, just the anesthesia just felt this patient would probably do better with a pre-med, this one probably wouldn't. That being said, there's been some parents who's, when I look at the kid, will be man, I think this kid needs a pre-med. And the parent's nope, he doesn't. He's fine. I just come in there, I hold the mask on. And I remember there's this 220 kilo kid or something like that coming in for dental. And I'm okay, we'll see. And the mom was right. She's okay. She just held the mask on and lo and behold, this big child just kind of listened and he did great. Yeah. And so, but I think too, some of the other tips and tricks is knowing if you think they need a pre-med, how do you get that pre-medication into them, or how do you get them to drink it, right? And so anyways, just, it's, if you are going to, so my kind of one of my common pre-meds I'll give is midazolam. and ketamine. The ketamine doesn't taste like anything, so I'll stick it in a syringe with some Tylenol. I give them that first, and then sometimes with a little bit of D50, so a little bit of sugar water, so it's nice and sweet. And then I'll give the midazolam. So I like doing 2 different syringes. So you give the ketamine first, tastes pretty sweet, tastes good, and then if they spit one out, okay, they spit out the ketamine or they spit out the midazolam. If you mix them both in the same syringe, then you don't know what they got or how much, and or which one or how much, right? And so do that first, and then it tricks them a little bit. But then I put the not so good tasting one, the midazolam, in the second syringe with a little more sugar water and D50 and everything. And then usually by the time they take the first one, they're like, okay, that was good. You get the second one in their mouth and they do a big and then that one, they're like, oh, that one doesn't taste as good. And then I'll give them a little bit of apple juice just to kind of help them down and stuff like that. And so it's trying to figure out little games to do the oral pre-med. And and then otherwise, it's like, I think another key is, as I was saying, a lot of these patients are going to come back for another dental treatment or some other MRI or whatever it is, really charting, okay, what worked and what didn't work. Yep. And to be like, oh, you know what? I gave this dose of pre-med. The patient slept in PACU for 3 hours. Most of the time, you don't, as anesthesiologists, we usually don't read the recovery room nursing notes, right? And but if be like, oh man, he slept for there in 3 hours. What I'll do is actually just write on the anesthetic record, really long sleep, right? Or too sedated. Consider decreasing the pre-med next time or something like that, right? Or man, was just really a terrible amount of agitation despite all this stuff. Give a little more Precedex at the end or something like that, right? Okay. And so anyways, so it's a balance, because then again too, at the backside of all of these, of the autism pathway is to actually hopefully minimizing the recovery room stay, so in PACU. And so again, because we know that as the hospital is a foreign environment, so we want them to stay in the recovery room as long as they need, as long as it is safe, but not too long, because then they can start getting a little more mad or just uncomfortable, right? Of course, and so it's like you're trying to almost walk on this knife edge sometimes to be like, not too little, not too much, but what's just right. And so,
That's good. And I mean, speaking of the wake up part as well, I think I've heard from a lot of parents that they're always a little bit concerned about, how is my child going to wake up from surgery? How do you counsel parents and patients on that? Like, just in terms of what that looks like in terms of the wake up phase. What's the risk of, we talk about emergence delirium sometimes, or emergence agitation. How do you counsel parents on that and sort of strategies to work on that?
Minimize that. So kind of one of the bigger things is kind of like what I was saying before is if they go to sleep early, go to sleep angry, there's a better chance they're going to wake up angry. And if we think they need a pre-medication or mutually agree, like, I think that'd be beneficial. Usually that does help with some of that emergent agitation or just the anger and stuff like that. Again, because that pre-med is kind of like COVID was, it always talked about decrease the slope of the curve, right? You don't want that big spike and then come back down. And so the pre-med is like decreasing the slope of the curve. It just goes up really slow, comes down really slow. And so the anesthetic medication in general goes on and off pretty quick. Like most of our anesthetics are pretty quick. And so some of these pre-medications or narcotics or things like that, I tell parents, you know what? If we give the right dose, hopefully they're just going to have a nice mellow wake up. And again, each child's a little bit different in terms of how that is. Some of them are just like still awake, eyes open, I'm ready to go. And then others are like, okay, they're a little more groggy. And so what you hope for is just a little bit of a slow, groggy wake up where they're not going to be pulling at their IVs, where they're not really going to be that nervous about any lights that are on or noises and stuff like that. Again, we try and minimize. If they don't like bright lights, we'll keep the room lights down. We'll try and minimize some of the extraneous noises and things like that. But usually I tell them if we can give them some of that pre-medication or even after they're asleep, give them medication. There's some good medication that kind of minimizes some of that emergence agitation. Usually it works. There's higher risk surgeries for emergence agitation and higher age group of kids for emergence agitation too. And so, sometimes even though you give everything, it's like, oh, it still happens. And then you just try and keep them as safe as you can while it's happening. And then you kind of make a decision. Okay, do they need a little extra medication? Or sometimes we go, oh, no, it's just the tincture of time. They're a little mad, but not super mad. And we can just wait it out. But if they're going to be
Mm-hmm.
risk of harming themselves or someone else, then we'll give a little extra medication just to help them through.
Yeah, for sure. And again, like just stressing that it's all about keeping everybody safe, you know, patient, caregivers, families, sort of everybody. So you mentioned that it's really important that surgeons refer patients with autism to this, to be screened by this autism pathway. Is there any other way that parents can get involved or get their child involved through this pathway, or is being referred by the surgeon probably the best route to do that?
You know what? Probably the best route. They could, if they knew that their child was coming for surgery, they could contact the Department of Anesthesia, just kind of like the regular anesthesia secretary. And so they would then be able to get that information that way.
Okay.
I haven't done this yet, but I've thought of like, hey, what if just spreading the awareness by contacting a couple of the autism organizations here in Saskatoon, be like, hey, we're doing this pathway here. If any of your kids come for surgery, there's probably a better chance if the parent knows about it and then they bring it up with the surgeon would put on there.
Yep.
There's still times that kids with autism do get missed and don't get the questionnaire ahead of time.
Yep.
The other thing I was thinking of doing is making an abbreviated questionnaire with mostly just a ton of tick boxes that the parents could fill out really, really quick, in like, I don't know, less than 5 minutes or something like that, right? If they happen to come and to be like, hey, can we give you this questionnaire? Fill it out to the best of your ability real quick. And then that way, at least the recovery room nurses, anesthesiologists, people caring for their child kind of know, okay, hey, let's keep the lights low. Let's give them some headphone muffs and stuff like that because they don't like bright noises and things like that, right? And so, so that is something that Carly and myself I think are going to work on an abbreviated form. Anytime you're dealing with forms with the hospital, it takes a little while to get all those things done.
Yeah, the paperwork burnout is real, but I think, in this case, it's super important. And, the more information we can gather earlier, I think it sounds like the better. So
no, it definitely is.
Was there anything else I missed on the pathway itself that you wanted to touch on or that you think it's important for parents to know?
You know what? Yeah, good question. There's some other anesthesia specific stuff. I think, for parents, if they want to advocate for their child, something that's really good is and I've told the surgeons this, but I think sometimes it might get missed by the surgeons, is if their patient is autistic, ask for them to be booked as the first case of the day.
Oh, yeah.
And then that way they're minimizing the fasting time.
Right.
You wake up, you can still give them, so for the kind of fasting guidelines for pediatric patients, you can still have as much water, apple juice, Powerade, Gatorade, clear fluid. If they're old enough to drink coffee, they can drink coffee, just no milk or anything like that. So they can drink as much as they want up to an hour before. Right. And so again, just trying to minimize, everyone gets stressed when you don't, or there's a physical stress with not eating or drinking. And so trying to minimize that, fasting duration is key. I think a good chunk of the surgeons are booking autistic patients as the first case. That being said, sometimes the more traditional way of booking patients is based on their age or chronologically. And so sometimes you'll get this older autistic patient waiting until the very end of the day for their procedure and just like, and sometimes it's harder, like so hard, trying to kind of calm them down or manage them when they're just thinking about food.
Right.
And then all this abnormal, they're out of their routine and they're in this hospital environment, which is completely foreign. So I think that would be a plug. Parents can advocate that way. And I think that would be a good thing.
Really good tips that we don't always think about, but that make a huge difference. So absolutely. Did you have any other advice for providers who are caring for, children with autism and anything else? I think, you've already provided so many great tips and we've had really good discussions in the OR about this as well. So
I guess if anyone wants a copy of this document we've worked on, happy to share it. And so I think that could be helpful. Essentially, we've formatted this from looking at what they're doing in Winnipeg and then also the balance program there. And to be honest, I think probably one of the keys is I've been working on this pathway, working with autistic patients, probably a little bit more than some of my other colleagues, but I still wouldn't consider myself an expert. It's just you're just like, man, okay, I still have a lot to learn. And so I think that's probably a key takeaway to be like, everyone is so unique. And it's like, okay, how am I going to form an individualized plan for this patient to try and give them the best perioperative experience as possible? And so I am still, always learning. And I think it's like, it's Yeah, it's a good thing, and but it keeps you on your toes as well. Too.
For sure.
So,
But rewarding when, we're able to provide that care for patients and make sure that they have a good outcome. So
yeah.
Awesome. Well, thanks so much for joining us again. It's always a pleasure to have you on, and you're so insightful, and you have so many great anecdotes and different initiatives and whatnot to help us both for families as well as practitioners. So thanks again.
No, you're welcome.
And thanks again to our listeners for taking the time to listen. And we will talk to you again very soon. Cheers.
Take care.
You've been listening to Airway Breathing Conversation, a podcast hosted and presented by the anesthesiology residents at the University of Saskatchewan. Please note that while this podcast is run by healthcare professionals, it is intended for educational and entertainment purposes only. We are very thankful to our guests for taking the time to share their wisdom with us this episode, and a very special thanks to you, our listeners, for tuning in. Don't forget to follow us and our associated USask Anesthesia accounts on social media. You can find all our social media links on our Linktree page at linktr.ee/abc_podcast. You can also find the department's social media links on their Linktree page at linktr.ee/usask_anesthesia. We'll see you next episode, but until then, stay calm, take a breath, and always remember your ABCs.